The Delta variant is behind more than 93% of all new COVID cases in the U.S. The significance of breakthrough infections where fully inoculated.
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
Inoculated people catch COVID. Well, that's hotly debated. Last week, leaked internal CDC documents warned that the Delta strain can be spread just as easily as by the vaccinated as it can be by the unvaccinated, although it is important to note that people who have received their shots are far less likely to get infected. So to talk more about this, give us some clarification, we're joined by Dr. James Hamblin. He is a preventative medicine physician and lecturer in public health at Yale. Thank you so much for joining us. So you have been very critical of the way CDC has handled their communications in regards to COVID, especially in light of the leak last week where we caught wind of these internal documents that talked about how contagious the Delta variant is, compared it to chicken pox. You didn't like how the CDC handled this at all. You read a newsletter. You called the way they handled this a nightmare. Explain what you mean by that.
Well, I'm not sure who's to blame here, and I don't have much interest in assigning blame. My hope is that we can get accurate information to the public in this confusing time. Partly the media is certainly to blame for sort of leaking and speculating about this document that wasn't ready for prime time. It was based on evidence that the document said, this is preliminary, we don't know yet. So to the very point that you made in the introduction, the document certainly raises the possibility of people who've been vaccinated then becoming infected and becoming contagious. And it seems that can happen. If you've been vaccinated, you can be infected and you can, in certain cases, transmit the virus to other people, and we should behave on the presumption that that's a possibility. But we do not know how often that is happening. And it's most likely that if you are contagious, it's for a shorter period and you're less likely to become contagious than if you had not been vaccinated. So I think the ultimate effect of a lot of that news cycle was to sort of raise concerns among vaccinated people, or to imply that vaccines are not working, but they are working phenomenally well. 99% of severe cases and hospitalization and deaths are among non-vaccinated people. So we are really looking around the margins when we start talking about the effects in vaccinated people. And we know exactly what we need to do in this moment. There's not as much ambiguity as I think we may see.
Let's talk a little bit about how the media has been covering COVID, because, of course, I'm part of the media, right, in quotation marks. Sometimes I feel like there's a bit of a conundrum. There's the way a story is covered, but there's also the way the content is consumed. So often people just read headlines and they don't read, the full body of an article. If someone wants to share a harrowing tale of how they were fully inoculated but was down for the count for a week because they got COVID, even if there's kind of a paragraph in there saying, well, the likelihood of severe illness or death is limited, I think sometimes that stuff gets kind of lost. How would you grade the media's coverage so far? Be honest, I'm prepared to take it, but how would you grade the media's handling of this pandemic thus far?
No, and I consider myself part of that body too. I think there are tons of great reporters and journalists individually doing a great job. And when we talk about the media, we're talking about this sort of aggregate effect of a bunch of small stories where there's no driving force that's necessarily messing up. But at the end of the day, what sort of feeling do people have after a certain set of news cycles? And so, I think a lot of people are doing really hard work and doing their best to communicate clearly. Just sometimes at the end of the day, at the end of a multi-day news cycle like that, you have an effect that is confusing to the average person. So you have to step back and say, no, listen, there's some very interesting and curious data that we want to continue to look into about the possibilities for transmission of the virus after vaccination. But for now, the message is simple and clear. And unfortunately, for the news, which thrives on things constantly changing, this isn't changing as much as it may seem. The vaccines are working extremely well, and the way forward is for everyone to get it. And if we drive that virus down to extremely low levels, we won't have to worry about breakthrough infections playing a significant role in our lives.
So let's just sort of clear the air in general about what we know about Delta. Now we're hearing about a Delta Plus. You've seen, all the data that we have right now, and, with the caveat that we're learning new things all the time. I think that there's a little bit of an issue with, what a certain phrase might mean for me as a layperson versus what it means in the medical field. That, for me, a bad case of COVID is that I'm in bed for a week. For doctors, a bad case of COVID is that you're in the hospital in need of medical intervention. So I think that also kind of confuses people, the way we talk about COVID. But just give us the basics. What do we need to know as regular folks about the Delta variant, about the possibility of Delta Plus? How should we go about our lives? Should we be wearing masks? That sort of stuff. Give us kind of your 3 top points.
Well, there's a lot there. And I think generally the advice that people have probably heard from CDC lately is absolutely accurate. They say, if you're in a place where there's high transmission, if there's a lot of virus around you, suddenly a mask becomes extremely high utility. Whereas if you're a vaccinated person and you are in an area where there's almost no virus and you're playing it very safe, you're not around a lot of people, a mask is going to be very low utility. So I empathize with them in trying to make a national guideline because things do, your risk is very much stratified by your age, how many people you're in contact with, where you are, and your own tolerance for risk. I mean, some people want to be told that they need to wear a mask because they want a 0% chance of ever having mild to moderate respiratory infection, in which case, yeah, I would wear a mask at every occasion. And if you're a vaccinated person who is in contact with only other vaccinated people and you're in generally good health, that mask is going to be a lot lower utility for you. So 3 points. Probably the biggest and most meaningful thing you can do if you're feeling lost in this moment, you confused, is talk to one family member, friend, community member, neighbor who is willing to engage and talk about getting vaccinated. We've got about half the country vaccinated, and if we could push through that other half, all of this would be negligible. But if we don't, if we continue to sit at about this level, there's going to be, as you mentioned, there will be new variants. We are going to be living in this constant state of limbo where vaccinated people are going to be at extremely low risk of having anything serious happen and extremely low risk of transmitting the virus, it seems so far. But not zero. And that possibility will loom in a lot of people's minds and a lot of business owners' minds, a lot of government leaders' minds, enough so that it's not gone. It's part of our consciousness, and we have to kind of constantly be playing this game where, it used to be when you asked me if you should wear a mask, it was like asking me if you should smoke cigarettes or something. It was a very clear answer. Yeah, don't smoke. And now we're into the margin where a lot of people are saying, what if I smoke 3 cigarettes a day? Well, I still don't think you should do that. But and then they're like, well, what about 2? What about 1? And it becomes almost impossible. So, what we know is clear is get vaccinated, help your family and friends and community members get vaccinated.
Yeah, that's the bottom line. Dr. James Hamblin, thank you very much.
Thank you for having me.